Good morning, everyone. We are from SGD B4. We would like to present our student project titled Psychospiritual Approach of Palliative Care. Here is our group members of SGD B4. Chapter 1 Introduction. Before we start the presentation, I would like to introduce myself first. My name is Niloputumaha Putri Kaika with the last three-digit number 155. Palliative care is the service that can improve the health service the patient has received. Palliative care provides holistic care on a physical, mental, and spiritual level. Lack of psychospiritual approach from the healthcare team has been reported to be associated with poor quality of life, dissatisfaction with service, less hospital utilization, and increased hospital costs, especially among ethnic minority groups and patients with high levels of religiosity. Despite the many benefits of psychospiritual approach in palliative care, psychospiritual care remains the most underdeveloped and often neglected area. In 2010, the European Association of Palliative Care established the Spiritual Care Task Force, which aimed to develop evidence-based spiritual care by creating a plan to inform research in this area, improving staff competence, confidence, and outcomes for patients and care providers. But still, psychospiritual approach in palliative care are still not widely known by the community and health workers as palliative care. Therefore, this literature review has been made to deepen this knowledge of psychospiritual approach in palliative care.
My name is Raymond Abarbudianto with strategy number 161. Now explain about the problem formulation, objective, and benefit of the study. So the first one is what's the definition, objective, and baseline patient criteria for psychospiritual approach. The second one is the definition, objective, and baseline patient criteria for palliative care. And the next one is the definition, benefits, methods, tools needed, outcomes, and challenges of psychospiritual approach to palliative care. So here is the objective. The first one is to understand the definition, objective, and baseline patient criteria for psychospiritual approach. The next one is to understand the definition, objective, and baseline patient criteria for palliative care, and also to understand the definition, benefits, methods, tools needed, outcomes, and challenges of psychospiritual approach to palliative care. And here's the benefit. The primary aim of the study is to facilitate a more profound comprehension of the psychospiritual approach within the context of palliative care as one of the crucial components of this educational approach. By delving into this topic, students will gain a more comprehensive understanding of the definition, objective, baseline patient criteria, benefits, methods, tools, outcomes, and challenges associated with the psychospiritual approach to palliative care. Ultimately, this research endeavor is designed to enhance students' overall medical knowledge, improving their valuable insights into this important part of healthcare practice. That's all from me. Thank you.
My name is Karen Nijila and my student ID number is 21025 11116. So the word psychospiritual is derived from two terms, namely the prefix psycho and spiritual. Psycho itself comes from Greek where it has the meaning soul and mind. Meanwhile, spirituality emphasizes a deeper connection with God and the universe as well as life's purpose, wisdom, and willpower. Consequently, psychospiritual approach is a method that focuses on psychological and spiritual activities. A psychospiritual approach is a form of psychotherapy that assists patients in overcoming obstacles by recognizing and altering dysfunctional thinking, behavior, and emotional responses. The solution to healing may not always lie in scientific or technological advancements in medicine, as the body, spirit, and mind are interrelated. Spiritual beliefs and religious life can serve as a coping mechanism for psychological problems, especially when dealing with illness. We learn to rely on God via prayer in all aspects of life, including sickness. Without prayer, stress and depression can slow down the healing process. When someone prays, he no longer relies on his strength, but he surrenders in totality and has faith that there is still God who can help and heal. Even in the midst of anxiety, Prayer provides spiritual stability, growth, and serenity, which is crucial, especially in palliative care.
Hello, my name is Gustia Gungatia Dharma with my last three digit of name is 087. Now I will explain about baseline patient criteria for psychospiritual approach. Psychospiritual therapy can be given to people with conditions such as pursue a spiritual discipline or path and try to apply to everyday life, experiencing unusual and unknown spiritual phenomena, experiencing internal conflict, facing life problems such as traumatic events, health problems like cancer, dementia and organ failure, drug addiction, loss of a loved one, and mental problems such as depression and anxiety. The Vika spiritual history tool can be used to determine the patient's spiritual history. Vika can be used by medical personnel to observe and provide spiritual therapy for patient needs. Vika include faith and belief, importance and influence of spirituality, activity in particular faith community, and address in care. That's all from me. Thank you.
Let me introduce myself. My name is Zafira Kumala Dewi with last three digit of phone number is 122. Now I will continue the explanation about definition and objective of palliative care. First, definition of palliative care. Palliative care, according to the World Health Organization, is an excellent tool for people coping with a condition brought on by life-threatening sickness or illness. It seeks to preserve, and even enhance the quality of life for the patient and their family in a variety of ways. Apart from that, palliative care can lead to the lower cost and help patients and families to make difficult decisions. According to the WHO, it is best to provide palliative care and curative treatment as soon as the patient is diagnosed. As a matter of fact, this early delivery method may reduce the requirement for unnecessary medical procedures and hospital stay. Next is objective of palliative care. Palliative care main goal is to improve quality of life for patients with life-threatening illness by focusing on a holistic approach that take into account to the patient's emotional, social, and spiritual needs in addition to their medical symptoms. Palliative care tries to lessen the patient's suffering by concentrating on symptoms, management, and pain relief, enabling them to keep their dignity and control of their life. It may go above and beyond standard medical care by encouraging candid conversation between medical professionals, patient, and their family. This creates a safe space where people can voice their values, preference, and care objective. That's all from me. Thank you.
Hello, doctors and friends. My name is Yoman Satya Mena Putra. My last register number is 050. Today, I will explain about the baseline patient criteria of palliative care. The baseline of patient criteria of palliative care have been expanded to include a wider range of patients with serious illness, like patients with cancer, heart failure, COPD, and dementia, as the primary candidate for palliative care. The studies also have expanded this criteria to include patients with other serious illness such as kidney disease, liver disease, and neurological disorder. The inclusion of younger patients with serious illness is another important trend in the baseline patient criteria of palliative care. The importance of identifying patients who meet this criteria for palliative care quality of life includes providing education to healthcare professionals on palliative care and its benefits. Overall, the baseline patient criteria of palliative care have evolved over the years and include a wider range of patients with serious illness, and healthcare provider must continue to adapt to meet the changing needs of the patients. That's up from me next.
My name is Virstanja Trikira and the last three digits of my student ID number are 199. Today, I would like to discuss about psychospiritual approach to palliative care. Psychospiritual approach to palliative care is one of the components of palliative care that is recognized by WHO because psychology and spirituality are basic dimensions that can improve a person's quality of life and can reducing stress on patient's body. Psychospiritual approaches to palliative care can be provided by a multidisciplinary workforce, including psychiatrists, psychologists, nurses, and social workers. This method can be done at home, hospices, and hospitals. However, because psychospiritual care is a complex field, it requires deeper education and training. Thank you.
My name is Fauzan Azimamika Javani with last digit of my student number is 131. Benefit of psychospiritual approach to palliative care. The positive impact of spiritual care of quality of life patients has been reported in many medical conditions, including organ failure, cancer, and dementia. Lack of spiritual support by healthcare teams has been reported associated with poor quality of life, dissatisfaction with care, less hospital utilization, and increased cost, especially among ethnic minority groups and patients with high level of religious coping.
Greetings, doctors and friends. My name is Bonifacius Alfianto Setra Pamungkas with Lasuda number 137. And in this occasion, I want to explain about the methods of psychospiritual approaches. There are methods of psychospiritual approach to palliative care, then we can divide it into two things. First one is popular techniques, and the second one is specific methods. The first one, popular techniques, being receptive and helpful, spiritual examination, spiritual counseling, spiritual interventions. And psychospiritual care can also be given through group activities such as support groups and religious services, in addition to these individual interventions. And patients who participate in these events may feel more part of the community and less alone in the journey. And these are the following are some particular instances of specific methods. First one is meaning making, ritual and ceremonies, support for giving and loss, and then spiritual care for families. Thank you.
Okay, let me introduce myself. My name is Putu Satyawijaya with the last three digit of student ID number 227. And I would like to explain more about the tools we use in psychospiritual approach to palliative care. Assessing the psychospiritual quality of a palliative care patient can be quite hard, as spirituality itself is something quite vague, and it may be influenced by the examiner's subjectivity. For that reason, many assessment tools were made to act as guideline or direction. All these tools are capable of executing one of three particular functions. First, spiritual screening, the process of evaluating the presence of spiritual needs and distress. This can be done using religious spiritual struggle screening protocol, for example. Second, spiritual history taking, the process of recording information centered around the patient's personal belief and religious customs. This can be done using hope assessment tools, for example. And third, spiritual assessment, the process of assessing more specific problems regarding the patient's psychospiritual state. This can be done using spiritual distress assessment tool, for example. These tools can guarantee a much more objective and uniformized approach in psychospiritual examination. Unfortunately, the existence of so many assessment tools also raises some confusion regarding what is the best tool to be used. They also have many other problems, such as the scarcity of information about their psychometric properties, lack of precision, and the cultural bias and the lack of cross-cultural validations, making it hard for these tools to spread worldwide. That's all from me. Thank you.
Hello, my name is Yusila Agung Libron Malaksana with real digit of student number R029. I want to explain about the outcome of the psycho-spiritual approach to palliative care. Outcome of the psycho-spiritual approach to palliative care can be measured using the palliative care outcome scale, either by patient or health professionals. The POS has 11 items that assess physical symptoms, emotional, psychological, spiritual needs, psychosocial concerns, and practical support. POS score range from 0 points that represent a better quality of life to 40 points that represent a worse quality of life. That's all for me. The next will be explained by my friend. Thank you.
Okay, hello everyone. My name is Madedenta Wirta with my last three digit number is 147, and I'm going to explain about the challenges of psycho-spiritual approach to palliative care. In healthcare providers, especially those working in the field of palliative care, often encounters spiritual distress when addressing the complex psychosocial spiritual needs of their patients. This distress is a multifaceted issue that can be influenced by various factors, including the patient's personal belief system and the circumstances of their care. Patients may experience spiritual distress when their deeply ingrained belief system are challenged by their illness. This distress can be worsened by external factors such as the loss of employment, financial hardships, or even scarcity of basic necessities. Other challenges, such as social isolation, can further amplify the patient's feelings of anxiety and depression. Additionally, patients receiving home based palliative care often face the issue of not having enough time to address their psychospiritual problems because of the time constraint between the home visits by the palliative care team. Okay, that's all from me. Thank you.
Hello, doctors and friends. First of all, let me introduce myself. My name is Franciscus Asisi Tokan with the three last digit of my student number is 092. So here I'm about to present about the conclusion of our writing. Okay, so basically the psychospiritual approach to palliative care focuses on psychological and also the spiritual aspect with the aim to improve the patient's quality of life and also to help patient to cope with their condition. So here a spiritual approach plays a major role which due to some study it can be very beneficial. The approach also can be vary based on the patient's preference to help them deal with their situation. There are a few methods such as group activities that can help the patient to cope. And here is also our suggestion from our study. So there should be more research to understand about the psychospiritual aspect in palliative care since it is proven to have significant role to the patient's quality of life, which can be beneficial to help the patient. Okay, maybe that's all from SGD before. Thank you for listening.